tonight, another single-day record for COVID-19 cases in the state. The Indiana Department of Health reports 5,156 additional cases of the coronavirus. To date, 224,374 Hoosiers have been diagnosed with COVID. The state also confirms 31 additional deaths. So far, 4,512 people in Indiana have died with COVID-19. Data from the Department of Health also shows that 26.3% of Indiana's ICU beds are available. That is down from 30% of ICU bed availability just yesterday.
It's because of these increased numbers that we've seen on a daily basis that Governor Eric Holcomb today has decided to take Indiana out of stage 5 of his reopening plan. There will be increased restrictions in place once again starting this Sunday, November 15th. WRTV's Stephanie Wade has monitored the governor's weekly press conferences nearly every week, including today. She joins us with what's changing so you are prepared. Stephanie.
Mark and Amanda, good evening. Well, according to a White House coronavirus task force report obtained by ABC News, Indiana has the 14th highest rate of cases per 100,000 people in the country right now. And with some hospitals already at critical bed status, employees and nurses are feeling exhausted, overworked, and losing staff. The governor announced new restrictions today that will go in place starting this weekend by county. Take a look at this color-coded map you see here on your screen. It's updated every week, and right now, no county is in the blue, meaning all counties have moderate to high levels of community spread. So beginning this weekend, November 15th, counties in the orange will be limited to social gatherings of 50 people. Red counties limited at 25 people. And indoor special events must submit a plan to their local health department and receive approval before proceeding. The mask mandate also remains intact. The governor announcing $20 million will be made available to local cities, towns, and counties to help with compliance. And as hospitals really begin to feel the pinch and worry they'll have to start cutting services and elective surgeries, the state health commissioner explains why taking a step back is so necessary.
We've doubled our cases every week for 4 weeks now, and we know that a certain percentage of those individuals, especially our elderly individuals, will end up in the hospital. And so consequently, if we turn this around now and decrease those cases, we still have that 10 days to 2 weeks of individuals that are still going to hit our hospital system. So yes, this is why we have to turn the tide now. This is why we need to make changes now. And, you know, the governor's talking about not wanting to close businesses down, but the reality is some of our schools are having trouble staying open because of the number of teachers and students that are sick and on quarantine. Soon that will happen, or is already happening with our businesses across the state. So one way or the other, things will shut down and decrease if we don't take proactive action now.
Now, to learn about more restrictions to come, again, starting this weekend in your area, you can visit our website at WRTV.com. Reporting live tonight outside the State House, Stephanie Wade, WRTV.
Thank you, Stephanie.